As Alan Lycan brilliantly defined, planning is bringing the future to the present so that you can do something about it right now. Hi, my name is Judith Rendon, and I like to be ready. My journey to readiness started when I was 5 years old, and my family and I immigrated to the United States. So this is when it all started. When we got here, one of the first gifts that my father ever gave me was a dictionary, because he understood that language was going to be important in my communication in this country, and he tried to prepare me as best as he could. Later on, I realized how important communication was now going to be in my healthcare. And this was on the day that I started feeling sick with the fever. So after VapoRub was not working at home, my mom and I, worried, got on the bus and went to the local grocery store. And we went up to the pharmacy counter and asked the gentleman in the white coat what he recommended with the fever. So as you can imagine, after a full month of kindergarten and practicing my ABCs, I was as fluent as it was going to get. And so, looking back now, with what I used for that encounter, I had my dictionary, we used hand signals and a sheet of paper so that I could understand what was needed to be done so that I could get better. So now I ask you, what would you take if you had to seek medical help right now? I bet most of us would say an ID and proof of insurance, and then after that, wing it from there. But what if I were to tell you, you're not only trying to communicate with the pharmacist, you're also trying to communicate with the doctor, a PA, a nurse practitioner, respiratory therapist, dietitian, and they're all coming into your room, trying to ask you all these questions throughout your stay. Would you feel prepared? It is time that we reprioritize how we prepare for medical encounters. Little did I know that over 20 years after my first healthcare encounter in this country, I would graduate with my Doctor of Pharmacy degree that now allows me to serve in the field that once served me. But unlike the gentleman in the community that helped me, I now serve as a clinical pharmacist in a hospital. So what do pharmacists do? So traditionally, pharmacists are known to dispense medications and ensure that they're accurate. But something interesting in the hospital setting is that we have access to your medical records, which means that we can look at labs, we can look at any notes that the doctors may have written, and also look at the history you have provided to better vet those medications coming in through our queue. In addition to this, we also participate in patient rounds and are able to communicate with doctors in real time based off of the information that we have and give recommendations to them to make sure you're getting the most optimal care. And in emergency situations like cardiac arrest or strokes, we're there at bedside preparing these medications so they are prepared and delivered safely to you. This is what a pharmacist does. The next question comes, since having these encounters, I have had the opportunity to see how hard the physicians work to get patients back home to their families. However, I have also come to understand that getting families back home to their loved ones may not always be possible. And during the time of a pandemic, I went from counting pills to counting deaths. So in these times of helplessness and vulnerability, if 80% of success is showing up, then how do we show up better? And I'm here to tell you that a tool you can start working on today that will help you give your 100% in these healthcare encounters is creating a medical readiness toolkit, or MRT for short. So let's go through a scenario. So Ms. Autumn comes into the emergency department after fighting COVID at home for 5 days. When she walks in, it's very clear that her oxygen has gone down significantly, and the team quickly jumps into action to begin her treatments. We are doing what we can to help Ms. Autumn in this time. However, because of her low oxygen, she's not really able to answer all the questions that she's being asked by her doctor, her nurse practitioner, the respiratory therapist, and registration. Miss Autumn is not prepared for this medical encounter and can barely communicate. So let's review the top 3 items that Ms. Autumn and you should consider including in this medical readiness toolkit. Number 1 is personal medical history. Have you noticed that one of the first health questions that you'll get is, what is your past medical history? Well, there's a reason for that. A study by Peterson et al. Showed that 76% of physicians' final diagnoses comes from your medical history alone. So what this means is that what you tell your doctor matters. So what should be in this personal medical history? Your personal medical history should include anything from your past, present, or future that will give the doctor a better understanding of your health. This can include any allergies, any surgeries, any family history, any hospitalizations that you've had. This information is important. And since I am the pharmacist in the team, it is my job to convince you that the most important part of your personal medical history is a list of your home medications. But all kidding aside, there are studies that show that up to 50% of medication errors that occur in the hospital are due to not having an understanding of what medications are being taken at home. Your personal medical history is an important place to start because at this time we do not have a universal electronic medical record. And if we want to have that information, especially in the hospital setting, it can take hours up to days to receive this information. The second item is contact information. And contact information can be divided into 3 main categories. Who are your doctors, who is your emergency contact, and who is your medical decision maker? On average, Americans see 19 doctors in their lifetime. By bringing a list of their names to your next encounter, you can provide the doctor a better understanding of the team that is part of your care, and also allow an opportunity for you to help optimize that team. Did you know that your emergency contact and your medical decision maker do not have to be the same person? Let me share with you an example. So I know someone who was in the hospital, and the emergency contact listed was a sister. So the whole time, the hospital is communicating with the sister, giving her updates, just reaching out to her. As this person got sicker, then they started asking the sister to make decisions for this patient. Well, little did we know that this gentleman had a wife in a foreign country. And ultimately, that led in delays of fulfilling this gentleman's wish. This is why it's important to understand the differences between a medical decision maker and your emergency contact. The last is legal documents. So I don't know about you, but I love my husband and my daughter with all of my heart. But I know that if it were up to my husband, he would bring me back 100 times if he could. And that 101th time, he would be up there doing chest compressions himself. But that may not necessarily be my wish. And so having documents such as a medical power of attorney or advanced care directives can ensure that my wishes are respected with regards to the treatments and procedures that can be done in an emergency situation. And in addition, it could help those that may be asked to step up in the case of an emergency feel more confident in the decisions that they're making. All in all, having these top 3 items starts to provide more context around you regarding your health. So let me share with you a real story of how a medical readiness toolkit came in handy. So as you know, since the start of the pandemic, over 42 million Americans have been infected with COVID. And unfortunately, I was no one special, and I got it too. Once I realized my diagnoses, I had to come face to face with my own mortality. Because being out on the field, I was seeing people of all ages passing away. And that could be me. So one of the first things my husband and I did is we sat down and we had to create our own medical readiness toolkit. Because I knew that we would both be the medical decision makers for each other. And what this looked like was just an honest conversation around the kitchen table, surrounding our health. And that's not something that is typically just talk around the kitchen table. This was something that we had to purposely sit down and think about. And so I can guarantee you that this conversation was anything but easy for both of us. But it became a lot harder whenever we had to have it around our daughter and my unborn daughter. And so, all in all, thankfully, our family was able to recover from being sick. But what if we hadn't? Had we just wasted our time talking about all of these things, having this uncomfortable conversation? No. Because the peace that I felt knowing that he and I were on the same page gave me hope that in the event that difficult decisions were to come, he would have the information that he would need. And we had talked about it. Now, if you do create medical readiness toolkits, I would say do not hesitate to let other people know. Because a medical readiness toolkit that we built for my daughter was given to someone we trust in the event that my husband and I both grew so sick and neither of us would be able to respond for her. We wanted to equip this person with the tools she would need. Nowadays, I wish it was all as simple as a 5-year-old girl at the grocery store getting counsel on her medications. But unfortunately, it's those scenarios that you have the least control over that tend to stick with you the most. Preparedness is not necessarily a new concept. Being prepared allows you to think more strategically, be more flexible, and have more resiliency in stressful situations. Just like we prepare for fire emergencies in our schools and homes, we should set aside time to prepare our medical readiness toolkits in the event of an emergency. And keep in mind, just like exit strategies will differ building to building, medical readiness toolkits will differ from person to person. According to Dr. Manuel Estrada, lead hospitalist at Texas Vista Medical Center, having a medical readiness toolkit is something that will help your doctor, especially when they are being outnumbered 40-1. This is how you become part of the team. And I want to leave you with this thought. Just as my father gifted me a dictionary to help me communicate, now I gift you this medical readiness toolkit as a means to help you communicate in your next healthcare encounter. And when someone comes and asks you, what should I take? And they're about to go to a medical emergency, I know that you will be ready to confidently say, an ID, proof of insurance, if they have it, and your medical readiness toolkit. Thank you.